Hi, my name is Bharania. I'm the Director of Humanitarian Impact Data for Salesforce.org. My job is to engage with the global humanitarian and international development community around the use of data and evidence to drive their programmatic missions and their impact. And I'm pleased to be with you today to talk about one of our latest technologies that is absolutely relevant to this moment in time, which is our product called Vaccine Cloud. And I'll share a little bit about what the product is, how it's being used, and some of the challenges that we see ahead. Before I go on, one of the first things I have to say is today, as I'm presenting, if I talk about things that are coming in future products, any purchasing or product acquisition decisions should be made on what's currently available now, not what's about to come in the future. And with that, what I'd like to say is the core why. Why are we actually doing this? The vaccination campaign for COVID-19 must be three things. It must be effective, it must be efficient, and it must be equitable. Effective means we need to see that these vaccines are able to actually start to bend the curve on the pandemic. Efficient means that we need to be able to do this with a minimum of waste and friction between manufacture and when the jab actually gets into people's arms. And of course, equitable. The pandemic is a global problem, and it's playing out in different scales and different rates in every community around the world. And we want to make sure that no one is left behind. As the WHO has said, no one is safe until everyone is safe. And so we all have a role and an interest in making sure that the vaccine campaign for the planet is as equitable as possible. And we think that our technology can help enable organizations and agencies at every scale and at every level to manage their vaccine programs' impact on the pandemic. So where did we start from? So last year when the pandemic struck, Salesforce initially came out with a number of technologies through our work.com suite to help organizations manage this shock to economies and societies, how to organizations look at contact tracing, scheduling, how to help organizations adapt to the new normal. A lot of organizations essentially went through an unplanned or emergency digital transformation. And so we wanted to help at least in that first phase. Another thing that we did was we actually started to source PPE for healthcare systems, both inside the United States, but also for around the world. And Salesforce was able to source 60 million units of PPE and distribute them to hundreds and hundreds of organizations around the world during the early phase of the pandemic when PPE was in such short supply. But going from vaccine or pandemic adaptation, which is how do we adjust to this reality? We're now moving into this phase of pandemic mitigation, which is how do we actually work to end the pandemic? And this is where our Vaccine Cloud solution actually comes in. We know, obviously, that this is not just a technology problem. This is fundamentally a human problem that, we've seen just in the last few days, the world cross into 3 million deaths from COVID-19. We've seen massive impact to global GDP, and the associated economic, social, political tensions that have been catalyzed by the pandemic. For example, we know that extreme poverty has gone up for the first time since 1998 in 2020. We know that indicators around gender and education and employment in so many places are going backwards. So there is absolutely not just the immediate health impact, but there's all of the secondary and tertiary impacts. And of course, we're now in a race to immunize the population. We need to get 7.8 billion people on the planet immunized. We need to get people vaccinated so that we can actually end the acute phase of the pandemic. And what this means is that this is essentially the biggest operation of our lifetime. I have spent 27 years in humanitarian response. I have responded to many global emergencies in that time, including the earthquake in Haiti and the Ebola crisis in West Africa several years ago. But the scale and scope and impact of this particular crisis dwarfs all of these other natural disasters and human-caused emergencies that I've worked with in that time. And every organization, every community is dealing with these basic challenges, right? How do we get logistics How do we sort consent and scheduling? How do we make sure that we're monitoring people for any adverse reactions? How do we make sure that we have interoperability between whatever existing healthcare data systems there were before the pandemic and whatever systems need to exist now? Fundamentally, vaccination is not a new problem. Every healthcare system in the world has had to deliver vaccines for polio and smallpox and influenza and all these other diseases that are more common to us. But what is different now is the scale, scope, and speed of what needs to happen. And so we have to touch billions and billions of people. So what does this look like? We talk about all the different capabilities in vaccine management. Like when we look at what needs to happen, we need to have things like inventory management. We need to have staffing support for both volunteers, healthcare workers. We need to have scheduling to make sure that people are coming in, they're able to get their doses when their doses are available, and that we're able to bring them back in for second doses when that's necessary. We need to manage consent. And of course, that's really important when later we'll be vaccinating children, probably later in the later half of this year. We need to make sure that we have like a single pane of glass so that health authorities can actually see how the vaccination campaigns are going on in their community compared to the spread of COVID-19 or the rates of ICU utilization or of deaths in that community. And we need to be able to do outcome monitoring. We need to know how people are doing with these vaccines. If there are any adverse reactions, we need to be able to detect that. And of course, in recent days, this has been in the news somewhat, but the fidelity of those signals is like 1 in a million. So our health surveillance systems and supporting health surveillance is really, really important to make sure that we are ensuring public trust in these vaccine systems. And of course, all of this has to be built for scale, speed, agility, and compliance issues, because of course we're dealing with healthcare information. And so things like security and privacy are absolutely critical to this process. So where are we right now? Right now, our solution has been rolled out to thousands of providers around the world, primarily in North America and Europe, but also in Asia and elsewhere around the world. We have currently supported the vaccinations of 50 million people, and this number is increasing every day. And the thing about Vaccine Cloud and our solutions is that we're actually looking fundamentally at a rapid response. So on average, it's taking about 3 weeks for one of our customers to say, yes, we want the solution, to when they're actually able to start jabbing people in the arm with this product actually underlying their data. And of course, speed is everything right now. And so the sooner that we get these populations jabbed, the sooner we can actually start to return to more normality in our day-to-day lives. And so it's really important that we have the scale, but also the speed to actually get a lot of these vaccines into many people at once. So there are a number of different capabilities that we have. And of course, not every organization uses every capability. Every organization gets to choose what they need given what they had beforehand and what the needs of the moment are. For health authorities, they really need operational insights. They need to know what the public data is doing. They need to be able to match that to their own internal private data and their KPIs. They need to understand their inventory status. They need to understand, which communities are at highest risk for being left behind to make sure that they're not, leaving anybody behind. To create priority lists for certain populations of individuals. So in many cases, we're looking at vaccinating the healthcare workers first, and then higher risk populations like the elderly. And then we need to be able to report on our compliance, usually to ministries of health or state health authorities or higher level authorities within government. They need to see how you're doing. For providers of vaccination, they need to run their clinics. They need to have the staffing that they need to jab all the arms. They need to be able to manage all their orders and supplies and manage their inventory. We need to have patient verification. And so we've seen this in some places where codes or mechanisms to target certain communities were being hijacked or used by other individuals, right? So you see people trying to jump the line, for example. And so you want to make sure that your vaccine management rollout happens with integrity based on the priorities that the health authorities indicate. We need to make sure that the vaccine protocols themselves are being followed. So, for example, each one of the vaccines that are out there has their own protocol for dosing, for administration, and for the 2-dose vaccines when the next dose can be administered. We want to make sure that we're following all of those protocols to get the best results we possibly can. And then for organizations, we want to make sure that we are focusing on equality. We want to make sure that individuals can easily find sites to get vaccinated. And this includes, for example, individuals who don't have access to technology. So in many cases, people will often go to the web or to an app to schedule their vaccinations. But for many, many people around the world, and in fact, 4 billion people around the world still have no internet access. It's really important that other mechanisms to schedule people are provided for. So this could be things like telephone hotlines, or even in low resource environments, community healthcare workers who can actually go door to door in communities and recruit people for vaccination. And then we want to make sure that we are able to send outcome surveys so that people can actually indicate what the quality of their vaccination experience was, so that we can improve the vaccination experience. And then in some cases where communities are rolling out digital health credentials as proof of vaccination, we can support that as well. And so we want to have this entire workflow here. We want to have this entire workflow from the health notifications and education, where we have to get people comfortable with vaccinations. And of course, there's a lot of questions and concerns by many people. Are they safe? How many are there? When can I get mine? What's the age that I can get? Who are the priority people who should be getting it right now? So there's a lot of education that needs to happen in communities to get communities ready and on board with vaccination. And so we want to be able to support all those notifications, all the educational content. We want to be able to match our capabilities to our vaccine management. So as vaccines become available, we want to make sure that we are efficiently getting those into the targeted individuals with a minimum of friction and delay, because of course some of those vaccines expire within a matter of hours once they've been brought to a normal operational temperature. We want to make sure that we are scheduling people for their vaccinations based on our inventory and based on our capacities. And a lot of these challenges are very, very hard logistically in small vaccination sites. But of course, we're talking about potentially tens of thousands to up to hundreds of thousands of people. Here in the United States, where I am, many of the largest vaccination sites are configured to support up to 10,000 to 15,000 people per day. But of course, those are the largest sites in the cities. But on the small side, we're looking at vaccination clinics in very rural, remote areas that may be only doing 100 to 250 sites vaccinations per day. So again, being very, very scalable, depending on the nature of what the location is. We want to actually administer the vaccines, be able to report those health records to authorities, issue credentials, and then monitor for outcomes. And all of this has to really be built on a couple of things. It has to be built in trust, because if the population loses trust in the vaccination campaigns, that will just increase vaccine hesitancy and vaccine resistance. We want to make sure that we are being focused on equity and equality. And what that means in every community around the world will differ. Here in the United States, there are certain populations who have historically been marginalized from the healthcare system. And consequently, those populations are the highest at risk for adverse outcomes related to COVID-19. And then we want to inform our decisions with data, right? Whatever our decisions are with data, we want to know that we know, and we want to be able to center our campaigns in data and in evidence, so that everyone has a real-time understanding as to the progress of the global vaccination campaign and the vaccination campaign in their communities. what I'd like to do is talk a little bit about individual features here and what it looks like. So from a vaccine, from a systems management standpoint, we can provide integrated, like single pane of glass, so that the chief health officer of the community might be able to just walk up to their laptop, open up their laptop, and very quickly see how their campaign is going in a single dashboard. And this gives government decision makers, government authorities, healthcare authorities, a very easy way to generally see how things are progressing in their community. For inventory management, these organizations, we want to ensure that we have not just enough vaccines, but also all the other supplies like syringes and PPE stocks. We want to aid organizations to accurately forecast their demand so that as you see the campaign ramping up, you're able to order the supplies in advance that you need based on your projections. And so we want to avoid waste, and especially for the vaccines themselves. We all know that the global vaccination campaign is struggling a little bit to get to every community on the planet right now. There are issues around vaccine equity that are playing out in very large ways around the planet. And what this means is that every single dose of any of these vaccines is incredibly precious to humanity. And so we want to make sure that we are minimizing that waste. And just as one data point, the World Health Organization for many years has maintained that, out of all the vaccines that are produced every year prior to the COVID-19 pandemic, a full 50% of those vaccines produced are wasted, right? So if you think of it this way, at a net level, if 50% of the vaccines produced on planet Earth every year are wasted, if you apply that to COVID-19, that basically halves what we have available. And so we need to make sure that we are absolutely focused on minimizing the waste that exists in vaccination campaigns. We want to be able to schedule people, and we want to be able to schedule people easily in a way that is reachable to humans. Communities around the world speak different languages. They have different levels of familiarity with technology. And so it's really important that the scheduling systems that face the public are frictionless and easy to use and allow for organizations and individuals to very easily see what they can do and how to get there. And so the scheduling is really designed for the mass public, for them to actually log in, see their available slots, schedule it, get confirmations, get notifications, get brought in. And of course, as I said earlier, this also extends to those who don't have digital access. So for many people who do have digital access, they can do it themselves. But for example, for elderly people or for people who have various disabilities who may need more help, for individuals who may speak different languages, we want to make it as easy for those individuals as well. And this may include all the way through things like telephone helplines or community healthcare workers. We want to manage our vaccine inventories. We want to make sure that all of our inventories meet the protocols that are established by the manufacturers. We want to make sure that people who are administering these vaccines are trained on the vaccine so that they understand the protocols of the different systems that are the different medicines that they'll be administering. We can actually use things like artificial intelligence and analytics to allow these agencies to assess a site's readiness, to cite a clinic's readiness to actually begin the campaign, to manage communities' health, and to log and track the administration of these efforts. And this is really important, especially when you're talking about underserved communities, to make sure that you're not leaving those communities behind. If you get into an area with like a mobile clinic, you can make sure that the site's ready, you administer it, and then you can actually track and make sure that subsequent doses get into those more remote areas as well. And then ultimately, you want to be able to monitor your health outcomes after vaccinations through data capture. You want to capture people's experiences. I mean, feedback is obviously a hugely important part of the global campaign. How was your campaign? How was your experience today? Did you allow yourselves to, was it an easy experience? Was it a more difficult experience? How do you manage the quality of that? Because especially as you're trying to scale up the vaccination campaign, you need to know how you're doing. You want to have outcome surveys, and you want to be able to start seeing things like trends. So hopefully, as your community's vaccination campaign rolls out, you can start to see the drops in deaths. You can start to see the drops in hospital utilization. And ultimately, you can start to see the drops in cases and community transmission. You want to be able to map your vaccination campaign's progress to the overall trend lines of the pandemic itself. And there are so many ways that you can track this stuff. But the thing is that this is all about maintaining trust in the campaign, maintaining your trust, the trust of your community in you and in your mission. And then ultimately, we want to be able to do things like have follow-ups. So people will have to come in for second jabs. They will need to be reminded. So SMS messaging, WhatsApp messaging, whatever's necessary in order to reach the community that you're trying to serve is what we can support. And then lastly, generating healthcare credentials. If you're like me and you've traveled around the world, very often you're very familiar with the little yellow card that shows that you've been vaccinated against hepatitis or Japanese encephalitis or any of these number things. In some communities around the world, they are looking at rolling out digital health credentials that may sit on your mobile device. And so you want to be able to have that, but also have it in a privacy-preserving way that allows you to demonstrate that you've been vaccinated, but is protective of individual privacy and civil liberties. And so as these systems integrate and roll out around the world, we can talk to those, we can integrate to those, and we can ultimately generate those credentials where necessary. So what does this look like in practice? I want to share a couple of examples of where Vaccine Cloud is in place today. One that I wanted to highlight is the city of New York here in the United States. The city of New York obviously is one of the most populated cities in the United States, and was an early hotspot for the COVID-19 pandemic in the early part of last year. About a year ago, New York City was the hotspot for the United States. And so it was really important to get New York City back up and running with a citywide vaccination campaign. And so their system is called Vax for NYC, built on the Salesforce platform. And it is built to the United States federal government standards for security and privacy, known as FedRAMP. It was configured to support the needs of distributing these vaccines, scheduling appointments, and conducting health screenings when people arrived on site. And it went live in a total of 3 weeks. And initially, it says here 650,000 vaccines were delivered in 2 months. And that, this has been going now for a number of months beyond that. So the total number of successful vaccinations has been probably up in the millions at this point. And one of the quotes from the customer here that I thought was really important was just that, we have to remember that, I'm sitting here talking about technology, but we're fundamentally talking about a human emergency. We're talking about people and communities. And when you see all this vaccination happen, people have very strong reactions of joy and of relief and of hope. And to me, that's like the biggest humanitarian benefit of all of this technology, is helping to restore hope into these communities and hoping to, give these communities a light at the end of the tunnel of where this pandemic's gone, especially communities like New York City, which have suffered so much through the course of this pandemic. But, this isn't just about the developed North countries. This isn't just about the United States, Canada, and Europe. The rich countries of the world are currently on one kind of trajectory. And even among the rich countries, some of them are doing better than the others. But the pandemic is fundamentally a global problem. And the vehicle to solve this global problem is something known as COVAX. COVAX is a collaboration between the International Health Organization's Gavi, CEPI, and the World Health Organization. These three organizations came together in the summer of last year to create this shared model for vaccine distribution around the world. And of the 195 countries on planet Earth, 189 countries are now participating in COVAX. The goal of COVAX is actually to get sufficient amount of vaccines in calendar year 2021 to 20% of each one of the participating countries. And this is an economic scheme and a vaccine distribution scheme so that the richer countries of the world can subsidize the lower and middle income countries of the world. And so the idea is that for those countries who can't afford to acquire vaccines for their own populations, getting this, having the richer countries subsidize acquisition and distribution is going to be really important to making sure it gets out there. And of course, back in February of this year, Ghana became the first country to get vaccines through COVAX, and over 100 countries as of today have gotten vaccine distributions through COVAX. Now, COVAX itself is supporting 9 different candidate vaccines. Some of them have been approved. Some of them are in various stages of being approved and will likely come online a little bit later this year. And increased funding is coming in all the time. In fact, when the United States rejoined the World Health Organization, there was a pledge from the United States government for an additional $4 billion, which made the United States government suddenly from not participating in COVAX to suddenly its single largest donor in terms of money. And so we are very proud from a Salesforce perspective to have partnered with COVAX to be the technology platform to distribute these 2 billion vaccine doses by the end of 2021. Our technology is the underpinning for this global scheme to distribute vaccines to almost every country on Earth. And this is a massive challenge from a logistics standpoint, from an economic standpoint. And we're just really happy to be able to provide the underpinnings of this. And in fact, I have been working with the World Health Organization personally since January of 2020 rather, even before the pandemic was declared. We were in early discussions with the World Health Organization, along with our partners in the Silicon Valley community, many of the social media companies, many of the other technology companies, to actually work together with the World Health Organization to talk about how technology could be mobilized for what we thought might be a big problem. I think it would be wrong to say that we didn't understand the scale and scope of what could happen. We saw the pandemic emerging early, and these collaborations between the technology community and the global health community started pretty early. And of course, this has continued on with not just at the international level, but including state and local governments around the world, as well as national governments. Our technology is not just used in the United States, the New York example here, but also many governments in Europe are currently using the same technology. Now, Vaccine Cloud, I've said this before in many other talks, that fundamentally, technology has never saved a human life. Technology has never saved a single human life. Ultimately, you need humans to do that. At some level, everything boils down to one person helping another person, whether it's one person treating another person who's sick or one person who is jabbing another person with a vaccine. Humans do those things. But what technology does is it enables more of those moments to happen. And so while we are fundamentally a support mechanism and a scaling mechanism for all of this human effort, we are very, very happy to be playing our part to help roll out all these vaccines around the world in communities all over the planet. And I just wanted to say thank you so much for your time today. Hopefully this gives you an insight as to how technology can actually help scale the global vaccination campaign, and how we in the technology industry might be able to assist our colleagues in the global health community with meeting literally the biggest challenge of this moment. Thanks once again, and I hope you stay safe out there. Bye.